Hi, Lawrence Ruck here, sports chiropractor in Tarrytown, New York. We're in some pretty uncharted territory here with regard to the social isolation strategies used to counter the spread of the coronavirus. As you know, there's been a slow, steady progression towards shutting down almost every form of social interaction. I never thought I'd need one of these to communicate with my patients. If you're a back pain sufferer, you may be worried about not being able to see your pain management doctor, your physical therapist, or your chiropractor. The good news is there are strategies you can implement today to help manage your back pain on your own. If you've been seeing a competent physical therapist or a chiropractor, these should look really familiar to you. While acute and chronic back pain are managed a little bit differently, there are some things you can implement throughout your day to help manage your pain. The key is doing them daily and implementing some of these strategies in your daily habits. And as you'll see with my third tip, trying not to do things which may be preventing.
Tip number 1, stay moving. Go for a walk, get outside, move your body. Try not to rest your back too much. Don't get in bed with back pain or sit in that soft, comfortable chair. It's depressing and will likely make you feel worse. With the exception of really severe muscle spasm, low back pain almost always feels better with movement. Now, while I recommend staying active, it's important to be smart. Don't do things that stress the back, like this, and this, and this, and definitely not this. Here are my favorite 3 spine mobilization exercises. I call it the 10-10-10 routine. First, perform the cat-camel motion for 10 reps. Perform these smooth and slow and within a comfortable range. If it hurts at an end range, shorten up the motion a bit. A little discomfort is okay. Sharp pain or spasm is not. Next, transition to a back stretch. In yoga, this is commonly referred to as the child's pose. Hold for 10 seconds. Lastly, transition to spine extension. Hold for 10 seconds. This is a really healthy motion for the spine that benefits many low back pain patients. However, there may be some backs that just don't like extension. If this is the case, try a modified version from your elbows and progress to the full version when able. Tip number 2, abdominal bracing. During back pain episodes, transitional motions such as sit to stand, getting in and out of the car, and rolling over in bed can be quite painful. The muscles of the back, the sides of the trunk, and your abdomen can be recruited to create a corset-like effect, stabilizing the spine during daily tasks. This is called abdominal bracing. Place your hand on your lower abdomen and push your waist out gently into your hand. This is performed without drawing in your belly button and without moving your pelvis. Another way to think about this is to imagine taking a light punch to the abdomen. Co-contract and stiffen your abdominal and low back muscles. It's a subtle motion, don't overdo it, and assume the harder you perform this, the better. Try to perform the abdominal brace during lifting, carrying bags, or any of the previously mentioned transitional motions.
Finally, I'd like to offer some do's and don'ts for home care of your low back pain. First, should you ice or heat? This is a really common question. Just based on more than 15 years of clinical practice, as well as personal experience, I think there's probably a role for both. The truth is, I'm not so sure the ice or heat actually penetrate deep enough to affect the tissues that are inflamed, but it can help decrease pain and improve mobility, and that's really what we're looking for to facilitate a quick recovery.
For acute pain, hot showers can make you feel looser, especially in the morning when things tend to be a bit more sore. I would try to avoid hot soaks or prolonged use of hot packs during acute pain. In years of practice, I've seen a pattern where excessive use of heat, although it feels really good, sometimes backfires, increasing symptoms. I've not seen that pattern with icing. For acute pain, I do recommend icing during the day, 10 to 15 minute sessions, perhaps 3 to 6 times per day. Remember to have a thin cloth between the ice pack and your skin. For chronic pain, to be honest, use what helps you most. My last bit of home care advice is to not try and stretch your pain away. Contrary to how it feels, your low back pain is not just from tight muscles. There are many factors that come together to cause low back pain. In an attempt to feel better, patients often perform aggressive stretching during painful episodes, sometimes making themselves worse. A good example is straight leg hamstring stretching, especially with a flexed spine. Time and time again, I have seen patients make their back pain worse by assuming that their pain was from tight hamstrings and trying to stretch it away. Remember, when you're in pain is not the time to work on your flexibility. I'd rather you focus on pain reduction strategies and improved mobility over trying to loosen up a tight muscle. Once you've improved, you can reassess the status of your flexibility. I hope these help. If you feel you've been stuck in a seemingly never-ending low back pain loop with recurrent episodes, you're not alone. Stay tuned for future videos and courses for taking control of your back pain, reducing over-reliance on ineffective treatments, and improving your day-to-day function.